Hey, it's your friends from Book Podcaster here.
Hi, everyone.
Look, we know things can feel like a bit of a pressure cooker sometimes, especially when you're staring down a huge chapter, maybe feeling stressed.
Yeah, like trying to drink from a fire hose. Totally get it.
Yeah.
Just take a breath.
We've got you. Think of this as your mental espresso shot, maybe.
Huh. Yeah. Quick, potent, and hopefully focused on what really matters.
Exactly. So today we're diving into something really, really crucial. And honestly, when you see how it connects, it's kind of mind-blowing. We're talking about the mental health of kids and teens.
Mm-hmm. And stick with us, because even if you're not planning, a career directly with kids, this stuff, it's surprisingly relevant for pretty much anyone.
So true. And we're pulling our insights today from a really solid resource.
That's right. Chapter 34 of Psychiatric Mental Health Nursing, Concepts of Care and Evidence-Based Practice. Townsend and Morgan, 10th edition. It's definitely a go-to.
Okay, so our mission, if you will, is to just boil down the key things, what you need to know about youth mental health. Clear, digestible, maybe even a little aha moment inducing.
Let's do it.
All right. So first big thing, I think, is remembering that kids aren't just miniature adults.
Absolutely not. Their emotional world, their thinking, their social skills, it's all still developing, right? It's a work in progress.
Which means mental health issues can look really different than in adults.
Exactly. They often present differently. It all ties back to understanding their specific developmental stage.
Okay, right. So what are some of the common things we actually see? What kind of challenges pop up most often in this age group?
Well, ADHD is definitely a big one. We're talking about those persistent patterns of inattention, trouble focusing, staying on task.
Right, and the hyperactivity or impulsivity too.
Yes, and or hyperactivity, impulsivity, things that really interfere with their functioning or development. It's, more than just a kid being a bit wiggly sometimes.
Got it. Okay. What else is pretty common out there? Seems like a lot.
Anxiety disorders are also very common, and they can show up in different ways.
Like how?
Well, you might see a child who gets excessively worried about leaving their parents. That's separation anxiety. Or an intense fear of social situations, so social anxiety. Or maybe just a general persistent feeling of worry about lots of different things. That's generalized anxiety.
Makes sense. And what about when a kid seems really, really down? Or maybe super irritable all the time? Is that just hormones or a bad mood?
It can be more, definitely. Mood disorders like depression, even bipolar disorder, they can happen in children and adolescents.
Really?
Yeah. And sometimes, like you said, instead of just obvious sadness, you might see increased irritability as a really key sign. That can be easy to miss sometimes.
Okay. Good to know. And then there's autism spectrum disorder, ASD. What are the core things to understand there?
So with ASD, the core features involve differences in social communication and interaction, and also the presence of restricted, repetitive patterns of behavior, interests, or activities.
And it's a spectrum, right? So it looks different for everyone.
Exactly. It affects each individual uniquely. The severity, how it manifests, it all varies.
Okay. And then, sadly, sometimes we see kids exhibiting really challenging behaviors.
Yes. Things like consistent patterns of aggressive or antisocial behavior.
Yeah.
That could indicate something like a conduct disorder. It's important to look at the pattern, the consistency, the severity was way beyond typical childhood limit testing,
Right. Okay. So that gives us a good overview of some common issues. Now, for someone in a nursing role, or really, like we said, anyone interacting with young people, what are the key takeaways? What should we keep in mind?
Oh, early intervention is huge, absolutely massive.
Why is that?
Because addressing mental health concerns as early as you possibly can, it can genuinely change a young person's entire trajectory. It can prevent much more significant problems later on.
So nurses play a role there.
Definitely. They're often on the front lines, identifying early signs, advocating for support for those early programs.
Okay, early intervention makes total sense. Catching things early. What else is really critical?
The family piece. You can't overlook the family.
How so?
Well, a child's mental well-being is just so deeply connected to their family environment. So things like family therapy, educating parents and caregivers, they are absolutely essential parts of the support system.
So it's not just about the child in isolation.
Not at all. Nurses often play that key role, bridging communication, providing resources for the families, helping them create that supportive environment.
Right, supporting the whole ecosystem around the child. Okay, can you maybe give us a quick example? How might this play out?
Sure. Imagine maybe a 10-year-old, let's say, with ADHD who's really struggling to keep up in school, maybe disrupting class.
Okay.
A school nurse, perhaps, could be central. They might coordinate with the teachers on classroom strategies, work with the parents on implementing structure and behavioral interventions at home, and maybe help connect the family to outside resources if needed. It's that coordination.
Gotcha. That really pulls it together. Okay, so quick recap. We've looked at how development plays a huge role, touched on common challenges like ADHD, anxiety, mood issues, ASD, conduct disorders, and really highlighted why early intervention and family support are just so vital.
Exactly. Recognizing these things, acting early, it can make such a profound difference in a young person's life. It really can.
See, breaking down a big topic like this, it isn't quite as scary as it first seems, right? You're taking this in, you're absorbing it, and that's a massive win.
Absolutely. You have the capacity to understand this complex stuff.
Keep that in mind when you're tackling those readings. Seriously, you're doing great. And hey, if all this talk about mental health is a little reminder to check in with yourself, please do that.
Good point. Self-care is essential.
You've absolutely got this. Keep learning, keep caring, and just remember to take a breath now and then. There's a whole field out there if you want to dig deeper, but for now, know you're building a really solid foundation.